One of the biggest concerns in the winter, a kid starts coughing, they take a chest x-ray and they see a pneumonia. First of all, what does the word pneumonia mean?
Pneumonia is an infection in the lungs. Quite simply, any bacteria, virus, or parasite which gets into the lungs, either by being inhaled or through the bloodstream, can cause a pneumonia.
There are different types of pneumonia, lobar, hilar, all the. Can you say a little bit about different types of pneumonia?
The different types of pneumonia really relate to the area of the lung that's affected and sometimes relate to the type of organism that's causing the infection. A lobar pneumonia means that an entire lobe, one large portion of the lung, is affected. An interstitial pneumonia would mean that it's an area of the lung that's between the lobes, in the interval spaces. You can also have a walking pneumonia, which is frequently caused by a virus, perhaps mycoplasma, but indicates an X-ray appearance that's somewhat milder and a patient who's not quite as sick as another patient with a more severe bacterial pneumonia.
And there's also one we call aspiration pneumonia, which you see sometimes in young kids who maybe vomit. Is that true?
Aspiration pneumonia is an entirely different type of pneumonia. Some patients who either vomit or have problems swallowing properly, such as patients who have neurologic disorders, may have some of the food or the acid in their stomach actually get through their upper airway and get into the lung. This aspirate will cause an inflammation in the lungs, leading to an aspiration pneumonia, which also can cause significant symptoms to the patient.
Is there any way just looking at an x-ray you could be 100% sure it's bacterial or viral?
It's been shown through several very well done studies that an x-ray is not diagnostic of the cause of the pneumonia. There are certain patterns of the x-ray that make you think a certain organism is more likely, but when push comes to shove, the x-ray is not conclusive in any fashion in judging the cause of the pneumonia. With that in mind, when we have a patient with pneumonia, we need to take a number of different things into account to plan for the proper treatment, of which the x-ray is merely one of them.
Sometimes a kid has a positive TB test and they take an x-ray. Why? Is they looking for pneumonia, or why would they take an x-ray after a TB test that's questionably positive?
When a person is tested for tuberculosis, the skin test that's placed will become positive if the patient had been infected by the bacteria which causes tuberculosis at any point in time. This is the first stage of the process. We then say the patient has had a TB infection, but not necessarily the disease. Only about 25 to 30% of patients who have infection will go on to develop full-fledged tuberculosis disease. In order to judge if a patient has disease, the chest x-ray is the next step in the process. Depending on whether the patient has only infection or has both infection and disease, this is what helps us plan what the proper treatment should be.
So the term we use with a negative x-ray is a recent converter, yet many times you select to give the kid sometimes medicine for a period of time?
Patients who are converters to tuberculosis, in other words, have TB infection without active disease, have a risk of approximately 25% of developing full-fledged tuberculosis disease. Since the disease of tuberculosis is so serious and the treatment to prevent disease is relatively safe, the recommendation is that we place patients who are converters for tuberculosis on medication to prevent them from developing disease over the coming future.
Thank you.